Morning. It's my pleasure to introduce Dr. Denice Zingman, who is a professor of medicine and biomedical engineering at the University of Iowa. And in addition to providing electrophysiology clinical care, she's focused her career on research into the mechanisms underlying cardiac arrhythmias and how abnormalities of the cardiac electrical system contribute to the initiation and progression of heart failure. Her research has included studies at the molecular level up through clinical trials in patients. Dr. Zingman is also director of the section of cardiac electrophysiology at the University of Iowa that comprises faculty with diverse clinical and research backgrounds who design and conduct their own clinical research projects, as well as enroll patients into national or international research studies in which the University of Iowa participates. Assisted by our expert clinical research coordinators and supported by our state-of-the-art facilities. With that, Dr. Zingman.
Thank you very much, Sam and Randy, both of you. I appreciate it. So here are my disclosures this morning. I do receive educational funding to help train our electrophysiology fellows from a number of device companies that operate in the electrophysiology field. So this talk today is going to be focused really on the patient's perspective of research. And the reason for that is that, patients have come to me and probably to a lot of clinicians as part of their clinic visit asking, are there any studies on my particular condition? What's the latest research? Is there something new coming out? How can I get involved, et cetera? So, I'll touch on some of the mechanics of how clinical trials work and also how marketing of new devices and therapies and particularly focused on EP, how that works and from the perspective of what it means for patients and how they can get involved in the kinds of studies they may be able to participate if they're so interested. So as a bit of background, I wanted to bring up that there have been numerous studies on this point, but in particular a study looking at patients' interest in doing clinical research. And it turns out that patients in general do want to participate in clinical research. This one study shown in this little black pie chart piece says that more than 70% of the general population believes that patients need more opportunities to be able to participate in clinical research. But there are a lot of barriers to patient involvement, and some of them are listed there in yellow. It's not a comprehensive list, but some of it may be, fear of the unknown, not understanding how studies work, not necessarily, trusting the people doing the studies, which is unfortunate. And then there are some, cultural values and beliefs about participation in research. A lot of these studies are conducted at specialty centers, and many patients just don't have access to specialty centers. But as you'll see in upcoming slides, there actually are a lot of opportunities that don't require a patient, to be at a large university center, for instance. And then also, just the awareness of the providers to let patients know what they can do. And that's really what this talk is about today. And of course, we probably all know that there continue to be a lot of disparities in knowledge about outcomes of different, drugs or other clinical therapies related to different subgroups of the population. So the more we can get patients involved in research, the better it is for everyone. But there are specific advantages to the patients that you may want to consider. And so, one is that patients could have access to a new treatment before it's widely available to the general public, including possible treatments for a condition that otherwise has no treatment. So we saw this with COVID. Some people got early access to vaccines or placebo, they wouldn't know, but certainly, access to a vaccine trial, some of whom would have gotten an actual vaccine. And there are also situations, for instance, when there is no treatment for a specific disease, and patients have kind of run out of options. And then there may be, for instance, a compassionate use of a research device or treatment that they maybe have access to as part of a clinical trial. Or again, compassionate use is not necessarily part of a trial, but it's an investigational drug or procedure. So patients can also, contribute to the development of knowledge that would help better prevent or diagnose or treat their condition. And so this really goes to the patient's sense of, of moral obligation and, sense of duty and altruism. Patients can feel very fulfilled to, have done a good deed for, for fellow humans. Patients can may be able to receive some treatments at a lower cost because the agency that sponsors the research may pay for some of the doctor's visits, medications, and tests related to the trial. Now, a lot of times, if those are tests or visits that they otherwise would have been getting as part of their medical care, they generally aren't covered. But sometimes there are extra visits and extra tests that can be beneficial to the patient. Patients can be apprised of the cutting edge options and upcoming approaches to treat a specific condition. So it turns out that, that it's very educational to be part of a trial, and patients can learn a lot about their condition. And that's what the next one shows as well. So, being part of a trial lets patients kind of be on the cutting edge and really understand more about, what are the new theories and what are the new approaches that may be coming up. And of course, patients can help educate the next generation of researchers and medical providers. So, training and education, again, go back to the patient's sense of morality and doing a good deed. There is the example of donating your body to science, which we'll talk about a little bit more. But also a lot of science is powered by the work of doctoral and postdoctoral trainees or early career investigators who are working in a mentored way on these research projects to become, productive independent scientists. So that's a valuable reason for many patients. And then, of course, some trials, especially the early, like phase 1 safety trials, which we'll talk about later, will reimburse patients for their time, expenses, and other inconveniences related to the study. So we'll talk more about that in upcoming slides. Of course, there are risks of any kind of research participation. They're not usually entirely known, but some are predictable. For instance, if you're trying a new drug and you know what class that drug is in and what sorts of, molecularly that drug goes, you can guess what the side effects are going to be. And if it's a surgical procedure, you can guess what some of the risks are based on, similar procedures. Some of the other ones here, loss of confidentiality. Generally speaking, confidentiality is highly protected in clinical trials. Data is anonymized so that although a record is kept of which data belongs to which patient, that is seen by as few people as possible and certainly not published or available to the general public to see. Patients could discover information about themselves that's upsetting. For instance, if they take part in a family a trial, that looks at genetics, they may find out that they're not actually related to whom they think they're related to. So, of course, the risks should be spelled out clearly ahead of time to every participant so that they know what they're getting into ahead of time. And that's really required for all clinical trials. Patients need to be well informed of the risks. They should be given a document to refer to later. So if patients have fears about the risks of a trial, they should know that they're not obligated to do anything without fully understanding all the risks and being able to ask questions. And of course, patients can withdraw from research at any time for any reason. Nobody is obligated to continue any research that they've begun. So, there's a spectrum of medical research. There's basic research, which usually occurs in an academic setting like a university or with nonprofits. For instance, the National Institutes of Health has their own researchers on staff as well as funding academic researchers. Other nonprofits, the National Science Foundation, there are various cancer institutes, there are advocacy groups and such that fund their own research for different conditions. For instance, there are several in cardiology. And the examples of this type of research would be things like molecular level studies, for instance, determining what growth factors contribute to stem cell differentiation, for instance. And then we move into translational research, which really is looking more towards things that are going to be used clinically within a few short steps of the research. So this is often animal models of human disease to test out an idea that may have, again, direct clinical applicability. For instance, translational research may test a new atrial tissue imaging tool to assess AFib ablation lesions in a pig model of atrial fibrillation. So, in other words, a pig that's been made to have atrial fibrillation, which normally a pig wouldn't, by like doing repetitive high frequency atrial pacing over a period of weeks or months. And then once that pig has atrial fibrillation, you do ablation just like you would on a human. And then you could go in with your new imaging tool and look to see if you can assess those ablation lesions real time. So that would be a translational research example. And then where patients mostly come in is at the level of clinical development. And this would be, first in human studies or pilot studies, and then phase 1 through 4 trials, which is usually referring to drug trials for the FDA approval. But we'll go into that a little bit more in upcoming slides. But again, this is the bulk of where patients would get involved. Now patients can donate blood or tissue for basic or translational research, or genetic material for basic or translational research. So not all patient involvement is in this last category, but that's where a lot of what I think patients consider to be involvement in research, a lot of that occurs in this clinical development stage. So when you look at the patient-oriented research, not animal models or basic research, you can break this down in a lot of different ways, but there are observational studies where you just look at what patients are already doing or already experiencing, and you try to understand the difference between, one type of patient pathway versus another, or one patient characteristic versus another, and look at what happens to those kind of naturally occurring populations over time. And that can either be retrospective or prospective. Clinical trials that we'll talk a lot about here are generally prospective research that is randomized. Doesn't necessarily have to be, but it's generally prospective, and it must involve you doing something to the patient that they otherwise might not have had done, and then looking at the outcome of actually intervening or doing something to the patient. And so an example of that might be a trial in patients with atrial fibrillation, half of whom get a new drug and half of whom get placebo or get the standard of care drug instead of the new one. And then the enrolled patients, again, they'd be randomized into which of those they get. And they typically would not be aware of their treatment group, which would be single blind. In other words, the patient doesn't know, but the investigators know. But you can also have double blind, where the investigators don't know either. Once the patients are randomized, their which category they're in is not necessarily known to at least the people who are analyzing the data. Obviously, somebody needs to know, but it should not, knowing the patient group should not weigh into the analysis. And so we'll talk about that a little bit more, the design of clinical trials in some upcoming slides. Another type of research is surveys or registries to understand the demographics of patients with a particular disease, for instance. And the studies, the patients would not necessarily be directly compared to an otherwise comparable group, but they can be. That would then be an observational trial, though. So an example in this category would be a study looking at trends in patient use of social media to understand their disease process, for instance. Or to look up new medical information or get medical advice. So you're just looking at trends over time. You're not comparing one group with another. And then another category that I alluded to before is postmortem. And this can be very powerful. Patients can donate their bodies to science. Not every institution, accepts donations on a regular basis, and there are a lot of constraints on that. But for patients who are so interested, they can make arrangements ahead of time. I believe it can also be done after the fact by family members. And the research done on donated bodies is, again, very useful. It can include the development of new surgical techniques. It can be studies of anatomy to understand the frequency of certain anatomic variations that may impact outcomes of other treatments or therapies. So there's research to be done in all those sorts of ways. So in cardiology and EP, that's a kind of the topic of the CME series. I'll focus on the different kinds of research that may be available to patients in this area. So drug therapy, for instance, new anticoagulation therapies for patients with atrial fibrillation, new antiarrhythmic drugs, new way of delivering antiarrhythmic drugs, not just a pill or an IV, but maybe there are new ways to get these into the body, or new dosing regimens. There are procedure trials where, for instance, you might look at a higher energy of ablation for shorter durations, or you may look at new techniques for more accurately mapping the anatomic origin of an arrhythmia. Dr. Rhodes talked about that during the last presentation. There also may be ways of correcting your 3D map of the heart that you're using for ablation, correcting it for respiratory and cardiac contraction movements. So those are all examples of trials that look at new procedures. Device therapy trials. There may be new pacemaker or defibrillator algorithms or new sensors that detect early signs of heart failure. There may be newer low profile electrodes that need to be tested out for the risk of breaking and their long-term performance. And there could be, entirely novel alternatives to transvenous pacing. Those would all, fall under the category of device therapy trials. There may also be trials of new diagnostic tests, for instance, new biomarkers to define the likely response to certain kinds of ablation or cardiac resynchronization therapies. And there could be new ambulatory monitoring approaches that have different success rates for picking up rhythm problems in patients. Genetic trials or family trials may determine, for instance, whether certain gene variants are pathogenic or increase your risk of having a certain outcome of atrial fibrillation, for instance. They may identify new familial syndromes that have previously not been recognized and what their genetic underpinnings are and potential treatments or cures. Registries, as you may know, once something is FDA approved, physicians don't necessarily need to adhere to the FDA approval. We have latitude as physicians, and also, the science and the knowledge base updates faster than the FDA can or cares to keep track of. And so physicians and providers have a certain latitude to practice within the current state of knowledge and standard for their field, which isn't always exactly what the FDA initially approved a device or a drug for. And so registries are really helpful to understand what is going on with a new treatment or an old treatment in the real world that may be different from how it was initially approved, or also in a broader population, because the approval process is usually conducted with a very tightly controlled population that may be not entirely representative of the real world. So these registries will kind of look at how things, how a drug or a device or a procedure measures up in real world, and whether that's different from its initial approval data. Databases, patients may deposit blood or tissue for future studies along with their clinical information. And again, that can go back to basic science as well. There are various studies that consist entirely of questionnaires For instance, to understand how certain therapies are perceived by patients, and understand patient barriers, for instance, to taking certain medications or anticoagulation, things like that. And as I mentioned before, there's the post-mortem. And specifically for electrophysiology, this may include donating your body to be used to design new ablation catheters. How do they move from one chamber of the heart to the other? Do they have the flexibility to get from one chamber to another? New pacemaker leads to see, how they would go in or how they would fit. New tools to do a transeptal puncture. Maybe new cardiac imaging tools. You can fill a cadaveric heart or chest with fluid and look at new imaging tools. You can develop new surgical approaches and techniques, or train people with a new technique. And then you can do things like understanding the durability of new techniques as well. Okay, so moving on. More specifically, circling back to clinical trials, I'm going to go into that a little bit more detail. And again, this is information to share with a patient in case they have misconceptions about how trials are conducted. So again, a clinical trial is specifically the investigators doing something to the patient. It's not just observational. What are patients already doing compared with another group that's not doing that? These are ones where you're actually intervening on the patient to see what your intervention does to their outcome. So a lot of times, again, this may be for something that's not yet available to the general population, but in other cases, it may be an available treatment that's being used in a new way, or testing it against other available treatments to see how it compares. So there are 4 clinical trial phases. Actually, there may be more. There's also, a pilot phase up here where the initial feasibility is tested. And that would, for instance, making sure that the proposed protocols can be implemented and that the outcome measures that you want to measure can actually be measured. So phase 1 here is often done on the healthy population. And this is really a great area for people who really don't have medical problems, but want to contribute, want to do something of value. This is a great place for them to get involved because they wouldn't necessarily need a specific disease that needs to be studied. In fact, the healthier they are, the better. So testing of new therapies or drugs on a healthy population fulfills this phase 1, which is really to look at safety. There's a lot of pharmacology to see how fast a new drug is cleared, what factors influence the processing of the drug and elimination of the drug. And a lot of times the maximum tolerated dose will be identified. Then phase 2 looks at whether the drug can actually affect the desired disease state or outcome. For instance, you might look at the ability of cardiac resynchronization to improve functional capacity in people with left bundle branch block compared to the same patients who don't get that kind of pacing for the left bundle branch block. And you can start to get an idea of how well it works, the one therapy against not getting a therapy or whatever the other standard of care is. And then also some dosing to see, how much of this do you need to give to get an effect. And then again, this is usually hundreds of patients. Then you can get into the phase 3, which is the really big trials. And this is to look at generalizability across the population to make sure that the effects seen in phase 2 can really be generalized to the population that's likely to be clinically indicated for this drug or technique. And then at that point, let's say it's a drug or or device, FDA approval would be sought if there appeared to be enough evidence to indicate that that it was effective and that the risk was acceptable. Once the FDA has reviewed and approved a new therapy or device, then you can go into this post-market study. And not everything has a post-market study, or they may have a registry, or they may not have anything. But that's, as I mentioned before, that's to look at how does the drug or therapy or device stack up against the data once you're looking at the real world, how it's actually prescribed, which may again be different from how it was FDA approved to be prescribed. And then looking for any, long-term or, secondary side effects that may not have been apparent in smaller populations, things that arise over time. And, and then there's also, is it profitable for the company and things like that. Now, if we're talking about a new drug that's going through this process, it would get something called an investigational new drug designation from the FDA that allows it to be used in a clinical trial. The approval for devices is a little bit different. And this is a busy slide, and again, this is not the purpose of the talk to understand FDA approval processes, but just to give you an idea, it helps to understand the kinds of research that's being done. So if it's a new medical device, they get classified as a class 1, 2, or 3. A class 1 is something with really minimal or no risk of illness or injuries. For instance, as they put here, gauze or toothbrushes, these are things that are going to be put in the body or used surgically. And so they have to be FDA approved, but most of them, the manufacturer will just apply to the FDA and they'll get an exemption. You can see that over here, class 1, low risk. They can just get an exemption right away and say, you know what, we don't really have to study this. It's kind of a no-brainer. But then there are class 2, which have, some risk of illness or injury, and those have to go through, an approval process, although it's kind of streamlined. So for instance, suture or needles, and so those can either be exempt, depending if after an FDA review, the FDA says, look, this is really, again, it's a no-brainer. It's substantially similar to something we've already approved. You've just, instead of one bevel, you've changed the angle on the bevel of your needle or something like that. It's essentially identical to what's already been approved. Just go ahead, you get what we call this, an exemption, or you can get just a pre-market notification, which is what this 510K is. And then you can just go ahead and begin marketing and using that. Now, there's class 3, which is where a lot of things in EP fall into, which is significant risk of illness or injury. And that would be things like pacemakers or new ablation catheters. Now, if there is a predicate device that's already been approved, and again, it's very, very similar. For instance, you just have a pacemaker that has a new battery that's got extended longevity or something on it. And otherwise, the pacemaker is really identical to a previously approved one. Then you can move over here, and even if it's in this class 3, you can move over to this pre-market notification 510K and then go ahead and start marketing that. However, if there is no predicate, then you have to go through this pre-market approval, which means that you pretty much have to do a clinical trial. And so we see a lot of that. There are a lot of clinical trials on new devices, and I'll talk about some of those in a minute. And there's not a specific version of a clinical trial that needs to get done for FDA approval. You pretty much meet with the FDA and kind of get an idea what it would take from their standpoint to approve whatever proposed device you have. And then you try to meet that the criteria that they set out for you. And, sometimes you have to go back and forth a bunch of times before the FDA is satisfied. So there's not really a preset, level of evidence that they will say, well, you do X, Y, Z and you'll get approved. And they kind of say, well, do X, Y, Z and we'll probably approve it, but you need to convince them. And so sometimes you can go around and around there. And so that's the process. And then once you once you get this pre-market approval, you can go ahead and market your device. And then there may be, again, registries that are required to test that the device is really performing the way that the manufacturers say it's going to perform, or you can get conditional approval. So coming back to clinical trials, whether it's a medical device or a drug, here's just the anatomy so that when you are interacting with clinical trials, you know who these people are and what their roles are. So the principal investigator is usually an MD, PhD person who is responsible for the overall conduct of the trial. And they often will be the contact person, but other people on the research team may also be the contact person, particularly the study coordinators, who are usually nurses or people, maybe they have a master in public health, or maybe they have other background training, but they're basically the experts on getting the day-to-day elements of the trial going, getting the IRB approvals and getting the patients consented and making sure that they're meeting all the sorts of compliances that need to happen. And then there are research assistants, nurses, biostatisticians, other people that work on the mechanics of the trial. They're the participants themselves, of course, who we're talking about today, the patients basically, who are volunteering their time, to enroll and help advance science, or doing getting one of those other benefits we talked about. The sponsors are the people paying for the trial. Now that may be the government through the NIH. It may be the university or other institution, Cancer Institute or something itself, or it may be a company that funds the trial. It could be even a Good Samaritan or a philanthropist funding it. But the sponsors are different from the people who are conducting the trial. They're the ones putting up the money, but they, generally speaking, do not analyze the data or otherwise dictate the specifics of how the data is handled or analyzed anywhere the outcomes are analyzed. So the center or where the trial sites are is just where the study's conducted. The Institutional Review Board is an ethics committee that every institution that does patient research, has one of these. And it helps protect patients' rights and make sure that the trial as designed is safe and that there are appropriate safeguards if something does happen, and they review the trial as it's ongoing to make sure that there are no unanticipated safety issues that come up after it started. And as part of that, some trials that are known to be high risk or have high risk elements will have a data safety monitor or even a data safety monitoring board, which is a person or board that looks, usually it can be quarterly, it can be more often. They look at the data that's coming out, they review any adverse events to see if the trial needs to be stopped. And these folks can put the brakes on the trial at any time if they feel something is not going according to plan, or that the risks are starting to outweigh the potential benefits, or even if the trial is futile, for instance. Excuse me. The FDA, we already mentioned, our federal government agency that sets the standard of how drug and device trials should be conducted and evaluates the safety of the drugs and medical devices. And they ultimately are the ones that need to approve anything before it can be used clinically. ClinicalTrials.gov, we're going to talk about more in upcoming slides. This is a publicly accessible mandatory registry of all clinical research performed not just in the US, but actually across the world, that assesses biomedical or health outcomes. Now we'll talk about clinicaltrials.gov more, but how does it regulate things across the world? Well, a lot of the big journals that publish medical data have agreed that they will not publish clinical trials unless they've been registered with clinicaltrials.gov. And so there are several purposes of this. The first is that, in the old days, which was not that long ago, You could do a clinical trial, and if the outcome isn't what you expected, or you didn't really want to publish it, it got hidden. Nobody knew about it, right? Nobody would know it was done. Nobody would know that it was negative, or that maybe even harm was caused by it. And so somebody could just repeat that trial. They may have the same idea and say, oh, that sounds like a great idea. Let's do that trial, and never known that it was already done and it already caused harm, or it already was negative. And so clinicaltrials.gov is a great way for people to understand what's already been tried, even if it didn't pan out. And so it helps avoid this publication bias, where only, unplug my phone here, where only trials that have a positive outcome are known to the public. It also lets people see what trials they can get involved in. It lets people have an early look at the protocols for the trials to see if they do want to do a trial. Maybe their protocol is significantly different from what somebody else is doing. And so you can compare and say, oh, well, they're not looking at this. I'll look at this particular feature. So it's actually extremely useful, and just really a wonderful thing. And that's been recently instituted. So again, how do patients find out about studies, or how do their providers direct them to studies? Well, one of the most valuable resources is clinicaltrials.gov. Again, this is sponsored by the NIH and the US National Library of Medicine. When I checked it last week, it had information on over 380,000 studies across all states in the US and across 220 countries. Now, not all of those are still recruiting. Some of them have closed recruitment, some have ended, some never started recruitment. But those are all the studies that you can look up and see, what their status is, how many people they've recruited, what their protocols are, et cetera. And I'm going to go into that in more detail and show people exactly how to get in there and look for a study. You can also go to hospital or university websites, and let's say you've got a cardiac problem, you can go to the hospital or university or near you and type in cardiology and atrial fibrillation clinical trials or something like that, and see if they've got, or just go to the website for cardiology care and see if they've got a tab that says research, or a link that goes to studies that you could get involved in. Clinical advocacy sites, there are big ones for diabetes associations, cardiac associations. I'm not sure if I can name all those right here, but, cancer also. You can go to their websites, and often they will have a tab for research or how do I get involved and things like that. And of course, you can check the news. You can also just do an internet search on your specific condition and see what might be, which people are publishing, and just contact those people directly. Generally, when people publish on a topic, there's contact information for the authors of that study, and you can see if they're doing another study or a follow-on study to what's already been published. Online social networking is very powerful and is being used more and more by patients. There may be Facebook pages or other social networking pages that are used by patients to get in contact with people with similar conditions that may point them to a source of research. And that's I'm not trying to direct people to any particular social networking. It's really all social networking. However, people get into contact with with people with mutual interests and look for research studies or other information on the condition. The provider's office may have pamphlets on certain research opportunities they can get involved in. People can ask their providers. They can ask others in a support group that they belong to what research there may be available to get enrolled in. There are certain listservs or phone lists that people may come across just to say, hey, I'm interested in research. Whenever you have something come up that fits certain criteria, let me know. And again, say a very similar thing, people can sign up for study notifications. Some institutions will have a website that interested people can go to and tell a little bit about themselves and what kind of research they'd be interested in hearing about if a new project starts up. So here we are for clinicaltrials.gov. Excuse me. And this is if you just type in at the top of your browser, clinicaltrials.gov, you'll get this homepage. And I've just highlighted a few things I've checked here. You can go to this Find Studies, or on this homepage, you can just fill out, this is kind of the quick search right here. I just looked at ones that are recruiting or not yet recruiting, things that people could, there's still a chance to get involved because they haven't closed or finished yet. And then you can put in whatever condition or disease you're interested in if you want, or you can just look at all studies. And here is just an example. I've typed in sudden cardiac death. So you can then, so if you hit search here, right here on this button, the next page you would see for the example I gave is this one. And you can see that there are some that are completed, terminated. There's some that are, unknown what their status is. And you can click on that and find out a little bit more information. It says it's past its completion date and the status has not been notified. So somebody just stopped participating. So that probably means that the trial is not ongoing anymore. But here you've got one that's recruiting and it's newly listed. So that's, kind of a fresh study that's going on. Here's some other ones that are recruiting. So, you can go in and you can click on those and it'll give you all sorts of information about who to contact if you're interested, what the protocol for the study is, how long it's likely to last, what are the hypotheses being tested, what does it, entail? And so very helpful. The other way you can do it is on that same page that I showed you a second ago. You can go to Find Studies and you can drag down here to Advanced Search. And then that will bring up a couple of pages. I'm going to do them 2 in a row here. But here you can, you can pick your condition and disease. You can look at, all studies, or you can go down here and just click recruiting. You can, and unknown, for instance, enroll by invitation, probably not, but active but not recruiting. That could mean they haven't started recruiting yet or they finished recruiting, but you can check what you want here. You can come down here and specify your age, or you can just leave it blank and it could be, it'll get all studies. You can pick gender. Here's a really helpful one: accepts healthy volunteers. If you are a healthy volunteer and you just want to get involved, it'd be helpful to click that box because, as I mentioned before, later stage clinical trials don't always use healthy volunteers. And so, you can weed through a lot of the studies that aren't applicable by clicking that box. And then this continues on to another page here where, again, you can look at the phases here if you want. You can only say, well, I only want to do NIH, funded studies or publicly funded studies. I don't want to do industry research or something like that. And then you can look, if you want the actual study documents displayed, you can get that done. And also, if you want to look through certain date ranges, I think that's going to be less helpful for a patient who is looking for research to participate in. So to summarize, patients can have a lot of reasons for wanting to participate in research, although they may suffer from, lack of information. And so hopefully this talk will allow clinicians to help their patients understand the kinds of research they can get involved in. And not all of it involves, taking a drug or being subjected to a procedure. Some of them may be questionnaires or registries or retrospective kind of analyses. And so, whatever the patient's degree of involvement that they're comfortable with, there's probably something out there for them. And that there are many ways to find out about these studies. You can let your patients know about these and they can do some research on their own, or you may want to assist them in finding a study that's right for them. So if there are any questions, I'd be happy to answer those. And I do have my contact information here on the right side of the screen in case somebody thinks of something later, or if they look up this talk once it's posted online and are joining after the fact instead of in the chat, and they can contact me that way. Thank you, everybody.
Thank you, Dr. Zingman, for that nice overview on clinical trials in clinical cardiac electrophysiology. I learned some new things there, and I hope the people watching will be motivated to check out some of the research that we have going on at the University of Iowa. And also, I think people will find it interesting to look at the clinicaltrials.gov website that you helped us navigate. So thank you.
Thank you. And I think if we have no questions posted at this time, we'll sign off.